people that get COVID are in the best place, because now they have T cell and B cell immunity. They have complete immunity to the whole structure of the virus, not just to the spike proteins.
Right.
So,
well, should people that got it be getting the vaccine?
Absolutely not.
Like, no. Why would they do that?
So that's a great question. So one of the things that I say to people all the time, I say, listen, if you're going to get the vaccine, okay, that's fine. You've made your choice. Before you do that, go get tested for antibodies to see if you have immunity. Maybe you already had it and didn't even realize it.
Right.
You're already immune to it. Now, I mean, that's the key thing. So that's the best. If you have, if you have immunity to it, why the heck would you get a vaccine? That's like subpar. I mean,
it's so crazy. Your body is dealing with it. Like you said, you're kind of lucky you got it. I have a friend that got it. She got COVID. She recovered without anything. She was like a lung flu. It was in the beginning. But then she just got the vaccine. She's still wearing a mask. And I'm looking at her. I'm like, wait a minute. So, this makes no sense. But some people are so stuck in this. But I've been saying to people, if you got COVID and you know you had it, you don't need the vaccine. And they say, no, you do. There's going to be another strain. Well, they don't have one for another strain.
No. So. I mean, these people are immune. And what's interesting is that I run a lot of the antibody testing. So I had a patient who, it was my first COVID case. It was like very, very early on.
Right.
And in the beginning, we didn't know what to make of this. I didn't know how virulent it was. This could be like an Ebola type of. I didn't know.
Yeah.
So,
and the news was showing us people dropping dead on the street in China.
And then when you go look back at it, it was
oh my God,
were forced into a nursing home that were vulnerable population, and they gave them no therapeutics. 90% of those people were vitamin D deficient. Afterwards, when we looked at it, 90% of the people in ICU have a deficiency in vitamin D. So their immune system, they were immunosuppressed, basically.
Right.
If you have a vitamin D deficiency, you're immunocompromised, plain and simple. And if you have adequate levels of vitamin D, the chances of you dying from COVID is very, very low, irregardless of your age, because the vitamin D will enhance your body and prevent you from going into that cytokine storm, which ultimately kills people.
Right.
So if you have a nice functioning immune system, so, they have all these therapeutics now, like this remdesivir and Regeneron, but the problem is that those drugs stop viral replication. You need to take those immediately, but they're only given in the hospital. So it's like, okay, by the time you get to the hospital, you're in dire straits. Like you're already in you're probably in a cytokine storm at that point. They should be doing those therapies as an outpatient, if anything.
Right.
Like, okay, they should be in all the doctor's offices. Okay, you came down with COVID, get in here immediately. We're going to administer this. We're going to slow the replication process. We're going to do some D. We're going to do some C. We're going to do some zinc. We're going to do some quercetin. We're going to maybe do some ivermectin or hydroxychloroquine. So throw the kitchen sink in at them in terms of that. In the beginning, people were going to the hospital and they had nothing. They would send them home.